What do I wish people knew about the history of birth in this country? It's a very good question to be the first question. I wish that people knew how important it was to not have people really relive traumas of previous generations with the way birthing is happening right now. And that would be my number one wish, that no birth traumas existed. That would be my first wish. The second thing that I wish people knew about birth is that it's not something to be feared. And doing birth work, you learn, it can go either way, right? It can be something that you plan for. It can be something that can be medical. There's different options, right? So I guess the second thing to kind of conceptualize what I'm saying is, if you don't know your birthing options is something that I tell people, then you don't have any. So I wish that if you could have your options, you knew what the options were, it would be less fear. So that's kind of how I would think that people would start understanding birth. And as far as, that's something that I wish people knew. That's the second thing. No birth trauma, less fear, more education. That's the third one. There's all types of people that can give all types of education and experiences on their own births. But going through some of the work that I've done for the past 12 years and up to the present, and how things have changed in the birthing culture, I'd probably say that education is the third thing that I wish people had. Again, going back to that notion of if you don't know your options, you don't have any. So educating people at a very much earlier age of their options and how to keep their body safe and healthy in order to have their options available, that education is the third thing. So yeah, if I had to sum it up, those are the three things actually that I would wish. So. I think the one thing that people take for granted is that a lot of people don't know how to advocate for themselves, period. They don't know how to advocate for themselves going into birth, and dealing with healthcare providers on all different levels is not something that people understand. It's a culture like any other culture, but having those options also help. A lot of people don't know you can have a water birth. You can have all these different types of opportunities to make something your own. But then when you go into a different culture or institution to have a child, your options are not the same. So providing people with the education early to be able to make good decisions about reproductive health whenever they decide, I think that that's important and very relevant to today. All across the country, depending on where you live, you have different opportunities, but what's in one place is not necessarily the same as another place. And the rules are different depending on who you are, what you look like, what your insurance is. So, and I also want to say like financial opportunities are different too with birthing. Being a birth worker, being a birth doula, it kind of puts us in the middle of being able to see a lot of different things at a community level, at a institution level with the hospitals, just being in the community period, seeing people have home births, seeing people have birthing centers, all of that is, changed dramatically. So being on top of all that is really a critical thing to do in my industry, because it changes constantly. So having somebody to help you with those, understanding those changes, I think is really important. So that's what birth workers do. That's what doulas do. We help keep you current on the trends, what's going on, where you're at locally. But with the National Birth Coalition, I also have to pay attention to what's going on in other states. So whether it's Georgia, South Carolina, Mississippi, that's part of my journey, is to pay attention to what's going on regionally. From a historical perspective, the medicalization of birth, from my background, let me just say, a lot of times people say that history repeats itself. I'll say that history is very, very, it rhymes, as somebody says, it rhymes. It's very similar, but it's not exactly repeating itself. When we talk about the history of birth with Black and brown people, indigenous people, BIPOC people, it's going to be different. It's going to be different from another person's perspective, another racial category's perspective. But from my perspective as a Black, indigenous birth worker, it's very hard to understand how in 2022, a lot of what I see is no different from the very beginnings of it's a lot of, how do I say it? A lot of miseducation. And in order to put it into simple terms, it's gotten so industrialized, it's about money, not the people. And it's always been about, to me, about the money instead of the people when it comes to industries that have basically, we have to start from the beginning now. Here it is 2022, but we're just now seeing reproductive justice being done. So without me going into the whole history, it's just pretty sad that it's 2022 and we just now getting to the place where we're acknowledging the birth traumas that have happened to people. So I can't really explain the whole background story about how we've gotten here right now, but I definitely can say we're not too much further now from the very beginning of the industrial part of birthing. Not too far away from that at all. I would pretty much say what it looked like in the past was pretty much people not having any body autonomy, okay? Nobody would ask you if you wanted to have, be a part of an experiment, for example, right? I'm not going to ask you, I'm just going to put you in an experiment. Well, still here in 2022, for example, Black women, brown women, I've seen and have heard they are still being put into experiments that they did not consent to. So that's an example of the past that's still happening in present day in my area, okay? So if it's happening here, I'm sure it's happening in other places in the country. Another example of what's happened before that still kind of happen today is being, and the first thing I could think of is, again, against your will, being forced to be a part of just things that are tragic. When I talk about birth and traumatic birth experiences, it's people not letting you know the education that you need to make informed decisions. Not giving you your lab work, for example, drawing your blood, but not giving you the information you need in order to get the blood work, for example, corrected, okay? So that's lab work. It's being experimented upon. It's being misgiven information or not given the complete information. It's pretty much being tortured because you don't know that fear, that constant fear that I see working with birthing women in my area. But at the same time, historically, we've never been really given that body autonomy. So now, again, 2022, we're just now opening up the opportunity to listen and hopefully move forward with getting the body autonomy that we need and deserve. So yeah, that's the biggest difference. Well, some of the just few things that I've seen, that's the biggest difference between now and then. Some of it hasn't changed, but it's the same concept of being traumatized, same concept of not having a choice with your body or given any information that enslaved people have done or have been through, for generations. History and culture of doulas, in my perspective, and that's the best way for me to say it, is in my perspective, have been around for ages. I think the terminology gets switched around a lot because in the BIPOC community, Black and Brown community, we're always sisters supporting each other. We're always there as sisters, cousins, aunties, in the community, all friends, always supporting each other with birth. So in our culture, we've always been there. There's no such like terminology that we had to have, just besides you're my sister, I love you, I'm gonna be supportive of you in your birth. I think that with the modernization, the commercialization of birth, that's where we started getting into these extra terms that get into the credentialing, that get into the, how we're gonna, make money off of it, the profit side of things. And I think that's where things got a little bit confused with where we're at right now. So when you talk about support and birth doulas, we always have been there. We're called different things. Whether you're speaking of, whether you're talking about the granny midwife, in the South, we don't have to put titles and labels on things a lot when we were doing this work in our communities. You didn't have to have it. But I think because it's been so commercialized over the recent years or a couple decades or so, it's become a money-making endeavor. So you have to usually call it a doula. But again, one of those things, birthworker, doula, it's changed through time, but historically it's always been Black and Brown and Indigenous people taking care of each other and supporting each other. So depending on the name you want to use, it's always been there. I can tell you the origins of gynecological care in the U.S. Pretty much have been on the backs of Black and Brown enslaved people in the country. It just has. Again, when you talk about changing and understanding the historical perspective and how we're here today, it's the modernization and the monetization that has changed really, truly a lot of the dimensions of this work. I do uplift the enslaved people, enslaved bodies that have had to endure having to create, a lot of the instruments that we use today, like the speculum. Every woman uses at her OB visit, yearly annual exams, like all of these different types of modernizations have definitely been on the backs of Black and Brown people. But the actual evidence is always seen in whoever is the victor, the doctors, the people that take the credit for the research, but the actual people that backs it comes off of are Black and Brown Indigenous people in the country. But I think that's seen everywhere, I think the times again are changing, and now we're at an age where, Black and Brown women and families are definitely taking, and birthing people are taking control of their opportunities, their autonomy. And I love this generation for doing what they're doing now and changing the tides. So I think this is a new type of place in history for birth and birthing people. It's changing. Right now, I don't think it's nearly to the heightened awareness that communities need to be as far as what doulas are. And that's just my education here in my community. A lot of people still do not know what doulas are. Again, the terminology is just not there everywhere. But as far as a pushback, I wish it would push back even more. I feel like depending on where you're living at, again, everybody's not afforded the same opportunity. So what I might have access to in my area, in my zip code, for example, might not be the same access of information to somebody else in another zip code. And yes, we do have, the internet, you can find things, but in this particular state, we're not organized enough yet. I would love for more parents to be, again, well informed with reproductive education and health and well being and choices and options of birthing way before we get to the place of I'm pregnant. That's when it's too late. A lot of times too late for some things. But as doulas, yes, we've got to organize a lot more because we're not quite as organized in this state as many other states. So the pushback, I think it's going to get a lot worse with the pushback, but hopefully doulas in this state will be organized and ready for the pushback as well, to be organized to be able to take the clients that they want and not have as much as what I see as competition. Because right now everybody's kind of, it seems like on different pages. So hopefully the state will have that organized so families will be able to find doulas a lot more accessible, especially for the people that need it. And again, it goes back to who are the people that are having the most trauma? Who are the people that need doulas the most right now? And that would be our BIPOC, our Black and Brown communities that's needing it. So that, for example, another one of the things is literacy, for example. And this is just going back to your other question. If somebody, for example, is not as literate to read all the documentation that you're given when you go into a hospital, that again is one of those things that could be a problem or a potential problem for birthing people. So there are many different levels, I guess, that's happening right now in the state of North Carolina. But with a lot of the BIPOC population coming up, Black, brown people, being able to see, whether it's a authentic, genuine community relationship that we're building, I think that's going to make the difference with a lot of this, building those relationships and communities so we can still learn together, still have the proper referrals for each other. There's so much more room to grow, a lot more room to grow within North Carolina and birth workers. I can't answer that question because I'm not a birthing person. But with my experience, the reason why I get calls, honestly, is because of conflicting information and fear. Without having, like, for example, I used to have a lot of military families that would just be, happen to be here in this area. And that's alone, you don't have the support that you used to have when you're at home with your mom and your dad and your immediate family when you're pregnant. Or you decide to plan your family. A lot of people nowadays are not close by with their families and relatives. So that's one reason why. The other reason why people come to me generally is because they want the knowledge. And that's just flat out no nonsense. I want the flat out knowledge. Tell me what's going on so I'm not a victim. That's a lot of times what I get. A lot of other times it's just because just the support person. Maybe let's just say the support person has no background either. So just people are just dealing with a real knowledge deficit of what it's supposed to be like and what their options are. And in this time, you can Google anything. But having a real person, it kind of takes the sting out of, do I know this is true or not, you know? But also having a real person with experience also helps. That's why people really seek me out. They know that, okay, ShLanda, I've seen you at the community level, helping with, making sure moms and dads at the WIC office, have good food. But then we also see you out here, with the community at the hospital and birthing. So they know the authenticity of people in their community that can help. So really having those connections, I think, is what people really want when they're birthing. And it's not that they don't have a good relationship or rapport with their OBs and doctors, but this is a different realm of timing, right? You're not going to be able to call the doctor at 2 o'clock in the morning and just be like, hey, can you tell me what this means at 2 o'clock in the morning? Or let's just say, on the weekends. Who are you going to call on the weekends? It's still a safety net to kind of have a best friend carry you through your pregnancy. It's a safety net. And if people kind of saw it like that, I think it would help them understand, kind of like other professionals. It's not like, it's like having a real true contact person for something sacred in your life. Just like you would have a wedding planner, it's kind of like having a birth planner, but somebody just to really, truly show you the ropes. I'd probably say about 6-7 months ago, I would have been like, oh yeah, we're part of the whole solution. But now we don't have the scalpel in our hand. We don't do the surgeries, right? We don't have in the hospitals the control of that environment, right? We're literally going into somebody else's house. With that situation, for, like I said, a hospital, we try to help avoid it, but we can't solve it because we don't have certain privileges. We don't want certain privileges, right? We don't want to be able to say or make the call, for example, oh yeah, she's having a cesarean. Oh, okay, she's gonna have, we don't want her to have a VBAC. We don't make those surgical calls. We don't make those decisions of what type of birth somebody can have. All we literally do is help support and guide the decisions that the birthing person wants. But in my perspective, we don't have anything to do with the birth traumas. We just literally try to avoid it and try to help solve the after effects of when it happens. Again, I'm speaking as a person that is not a parent, but just from my perspective, this country has a lot of money that can be made, and putting limits on things and people and their options and opportunities. It's one of those things. It's going to be a battle. It's going to continue to be a battle as long as money's involved. As a doula, I am a support person. I'm there to help be a part of the team, period. That's it. I'm part of the team. I'm part of the birthing team that's hired usually by the parent. They chose me, I chose them. And that might not be the same for the doctor. Sometimes the doctor is not chosen by the parent, but just chosen by random and insurance. I think it's special to be chosen by families. It's special to know that that's the person that's going to be there for me to support me through this. But the relationship altogether, it's like anything else. If you have a triangle, let's say, somebody's usually gonna get jealous. Somebody usually has at some short point in time shows that jealousy streak. Because doulas don't hold power, okay? Birth workers don't hold power in a hospital institutionalized setting. It's kind of hard for us to get jealous and try to make a move. So again, being a part of the team and just being literally an advocate to be able to get somebody's words out who might not even have a voice, right? Who might not know anything about the process. That's what we do. We spend that time in really understanding how can we make this be the best outcome for you? How can I get to know you, right? And make this be a pleasurable experience for you? And not only that, how can I get to know this doctor, right? Who's going to be helping you give birth, or helping you deliver. Helping somebody give birth is not the same thing as helping someone deliver. There's one thing that, we can do ourselves and empower ourselves to birth, right? But there's something different when a doctor decides he wants to deliver. So I guess it's kind of all running about the same. You have power, you have verbiage, you have the institution that you're at. But to be a part of a team, you have to, say, hey, I'm here, I'm supporting her, I'm supporting the birthing person. How can we do this together? And that usually starts very early. The earlier it can start, the better. But yeah, that's what it's supposed to be. It's supposed to be a team. She's 100% right. There is that's exactly what my experience has been. White parents hire me to help them advocate because of, let's just say, just for the verbiage, okay? But I also have had white parents hire me because they knew the instinct. They knew that they wanted to bond and have somebody that was close to them after the birth, right? Some people just don't have any support, right? So it goes both ways. I also say when I'm hired by Black families, it's fear. It's usually fear. And the fear, starting off at that basic level, it is survival. That is what survival is. Survival is fear with a lot of the Black families I work with. It's hard to do all at one time. That's why I think it's important that birth workers, especially BIPOC birth workers, get paid more. And that's why I do advocate for that, because on top of that fear, until we get past the fear, you really have a hard time getting to advocating. And with a 9-month period, 8-month period, maybe even 3-week period, you can't get through all those layers with the Black or BIPOC population. Whereas with a white family, okay, we're dealing with advocating, cool. But you have so many more layers with Black and brown families and institutions and history that I don't know, there's probably not enough money to go through as much work that we have to do with our Black and brown families compared to the white families that we work with. Everyone should care about the issue of birthing and institutions for a lot of different reasons. But when it comes to down to it, it's like a human right, It's your birthright, it's a human right. And if we're getting it wrong for so many BIPOC people, we're getting it wrong for, just different levels, right, of government this past year, just getting it wrong, then maybe this is a place where we could start and get it right. And that's why somebody should be paying attention right now. It's okay. We get the past. We're not going to blame. We're not going to do any of that. We're going to move forward right here and right now and make sure that now we can move forward together. Now that everybody's on the same page, hopefully, and has a little bit of information on, or did their own research at this point, okay? Did their own research on the history of birth, did their own research on BIPOC birth as well, our history of enslavement, and just understanding the country in general. Now that we're all on the same page of what birthing looks like, at this place in this space in reproductive health, we all need to be moving forward together to make it right. Because if it doesn't get right now, it's not going to get right soon. It's just not. It's not that simple. It's very complex. And just trying to get it right is not one person's job, it's everybody's job. So that's why, I say, we also have to make sure that we include everybody. We have to make sure that we're including BIPOC, we're including white, we're including LGBTQ plus. Everybody that is birthing needs to be a part of the conversation. Everybody that's supporting birthing people need to care and be a part of that conversation. And everybody that's an advocate. Okay, so there's a whole wide range of people in community. And not only that, it should be everybody's problem if you don't have the resources to help make these experiences better. If you're not making it better, it's not gonna work in the future. So even grandparents, I tell them, I was giving a speaking engagement a couple weeks ago. Even grandparents need to be caring about their lineage, their legacy, their children, because it's generational. Either the positive, the negative, it's held in our spirits, it's held in our bodies, generation to generation, and that's just scientific epigenetics fact, right? So we got to make it better for everybody. I'd say if you don't want to have children, that's fine. And I just would challenge them to think, if you never wanted to, for example, find out why your stomach aches sometimes, right? If you have a heart condition and you never find out what that ache is in your heart, right? Any other place in your body, you would go check out and see, hey, how can I find out what's wrong with me? Or how can I find out how good it's going to be or how well I'm doing, right? You have options. You can go to a holistic practitioner. You can go to the institution. But the one thing you should still do is to check how your organs are working and your system is working and making sure that you're healthy. You're not getting any type of cancers, any type of diseases. Just because you're not using it, decide not to use it, doesn't mean that it doesn't exist in your body. I hope that makes sense, because you still have a reproductive system in there, right? Depending on if you want to use it or not, doesn't mean you don't keep it healthy. Doesn't mean that you don't pay attention to it. So that's what I would tell them. Okay, fine, that's your choice to not use it, but don't be absent to think that it's not something you need to be making sure is not going to cause you any harm, or if it's in good working condition when you might decide to change your mind. You want to make sure that you're being heard no matter what. Yes, you got to make sure that you're being heard with any of your concerns of your body. Like I said, whether it's reproductive concerns, heart concerns, gut concerns, just take care of your body. And that's part of taking care of your body, knowing what's going on in it. And that's what it is. That's what it's about. Whether or not you want to have now or later, just understanding your body. Doulas are able to safeguard through pregnancy, before pregnancy, after pregnancy. That's like the real deal. And when I say safeguard, in my opinion, safeguarding is number one, emotional, okay? The ups and downs and emotional journey of pregnancy, bringing new life into the world, that has to be safeguarded. Those anxieties, reducing those fears, that emotional part of what doulas do, that is like the number one critical thing, reducing the fears, reducing the anxiety. The second thing, again, that's most important that we didn't really touch on a lot is the physical aspects, the physiology of your body and how that's going to change, and how doulas safeguard a person with that is making sure, hey, yes, your breasts are supposed to change. Yes, you are going to gain weight. So there's body nuances and physical changes that that the body goes through as well. So emotional side of things, doulas help. Physical side of things, doulas help. The educational side of things. Doulas, not just like me, well, other doulas that do like I do, we have dual professions most of the time. Something usually prompted us to become birth workers. So whether it's us, hey, starting off in nutrition like I did, working with prenatal, postpartum women and children, my avenue and my gateway to helping the families, that's doula work, so we sometimes combine it, so I think that's a plus, having people with various backgrounds, whether it's nutrition, whether it's nursing, whether it's social work, being a birth worker and the dimensions of emotional, physical, educational resources, that's what we do. Well, reach me at the National Birth Coalition. I'm just kidding. The National Birth Coalition, when I tell you after this year, it's really put us in a position where we are working on the national level, we're working on the state level, and we're also working on the local level. So being a part any of those community initiatives was really, really helpful. So next year, as we move forward with other birth workers, the donations are always, always needed so that we can educate our community, educate more birth workers in our community, helping us have our advocacy classes, which is different from birth work because it's different skills that parents can use for advocacy. There's just a lot more support that we can definitely have, whether it's policies at the city level, maybe the hospital helping us work together as a team to create better policies for birth workers and doulas in the hospital. There's so many different levels, but we definitely welcome and want as many people that are birth workers, birth advocates, and supporters to please feel free to reach out to us on our website, nationalbirthcoalition.com. One of the things that I really want to advocate for is for insurance reimbursement. I think that anybody that wants a doula should have one. And yes, priority right now that we're looking at is for the BIPOC population to have a doula if they want one, but also having the funding to educate people in the community what a birth doula is. Because everybody, again, with that terminology, it's not on everybody's same page. But yeah, we really want to focus on education right now with parents and reproductive health. With younger generation. So let's just say preteen young men and young women and LGBTQ birthing people. We all need to be on the same page within our communities with birthing options and opportunities. So working as a seasoned birth worker, I am what's also considered an advanced certified birth doula. And that designation is usually because of research that I've done, or is because of the research that I've done with birth workers. So even though on the front end, it kind of looks like I just started doing birth workers in the community, I've always worked with birth workers, but transitioning into the nonprofit sector is what more I felt like I had to do because there was no Black BIPOC nonprofit here for reproductive justice in my area. So that's kind of how I transitioned into it. It was completely due to COVID, the protocols, the different type of amounts of money that had to go into the hospital system in order to get in was just one of those things that I had to figure out how can we get in and do it safely and help our community. So that's pretty much why the nonprofit was created. And then came the educational part, letting other people know that Black and brown BIPOC doulas are here. There was just a lot of different levels to it, I want to say, but being the very first reproductive justice um, nonprofit that also works with food justice, food access. That we are the first ones, and that was just kind of our calling to do, just with our birth workers, with our community. The North Carolina Department of Health and Human Services called a meeting for a lot of BIPOC birth workers and doulas, and had like three different areas. They did a hybrid meeting. Raleigh, it was in person. I want to say Charlotte was the other place and location. And then on the coast, they had another location. But basically, they were giving an update on asking doulas and birth workers what they wanted to do with their options of getting reimbursement through private insurance companies or Medicare, Medicaid, and basically asking doulas, hey, what do you want to do in this process? Do you, how you all want to come together and get reimbursed? Do you? Don't you? They're asking for our opinion, and that's really a big move in the state of North Carolina to get Medicaid reimbursement for birth workers, for doulas. And I'm really excited about that. In December, we have our next meeting. So it's just an initial meeting to see who's interested. And then December, there'll be some more information that we'll be able to give back, feedback, because, now is a time for us to kind of have a minute to kind of think about some things. And then when we go back, we'll be able to work together, hopefully with the state, and fill out some perimeters of what we would like as guidance here to come together as doulas. Ideally, in the birthing process, I would like to see it being culturally competent to people's culture, and dealing with, the education piece of how to prevent traumas, how to prepare yourself. Again, I think it could happen at two different places. It could happen in college, for example, where people might have decided they don't really want to do anything or having a child right then. So educationally, I think there's different levels that we can get there with. I would see advocacy as being not thought of as a bad thing. Being a part of a team where advocacy is not seen as a threat. I think that's the best way for me to describe it. Advocacy shouldn't be seen as a threat. Advocacy should be everybody on the same page to give a person what they want in their birth. But right now, until that kumbaya moment happens, we're going to keep, I guess, hitting our heads up against the wall until, somebody surrenders, I guess, because it should be a team. And I'm not going to say somebody surrenders. Let me not say that. Until we all find a nice place, an even ground that's mutually respectful. I think that's what will help. When you find a practitioner that's respectful of other people and their cultures, when they're respectful of a person as an individual that wants their autonomy, but is willing to help get them there, that will make a difference. That will help everybody. But until that happens, the community's going to have to want it and demand it. That's the only way it will happen. I just think that where the National Birth Coalition falls into place is a very unique place. Being here right now at this time in North Carolina, and then branching out to other places, I think it's a lot more work to be done and a lot more connections to be made. But I also feel, since it's the very beginning of reproductive health work and reproductive justice work being done here, there's a lot more opportunity, and I'm excited to see where it goes on a national level, state level, and a local level here. And hopefully we'll be able to help serve the community and their needs and desires a lot better than what we've had so far, I want to say.